Hi, I'm Dr. Ilya Leyngold. I'm a board-certified oculofacial plastic surgeon, and one of the most common things patients tell me is, I wish I could get clear, honest answers about facelifts without having to book a consultation first. So today, I'm doing exactly that. In this video, I'm going to answer the most common questions I get about facelift surgery: candidacy, age, technique, recovery, risks, results, and everything in between. And what better way to do it than to make it completely free and available here on YouTube. Whether you're just starting your research or you've been thinking about this for years, my goal is to give you as much clarity as possible. We're going to talk about what makes someone a good candidate, the difference between a full facelift and a lower facelift, what recovery actually looks like, how long results last, the risks and benefits, the technique I use to create a natural, long-lasting outcome, and much more. If you're considering facial rejuvenation, this video will save you hours of searching and help you understand what's truly important. And by the end of the video, you should have a much clearer sense of whether a facelift is the right option for you. So let's get started. Am I a good candidate for facelift surgery? A good candidate for facelift surgery should be in good overall health, not use any nicotine products, or able to abstain from nicotine products for at least 3 months before and 1 month after surgery. In addition, best candidate for surgery has realistic expectations regarding her or his result, stable emotional state, and good support system to allow seamless recovery after surgery. Ideally, the right candidate is at the stable weight, as significant weight loss or gain can negatively impact long-term results. What is an appropriate age for a facelift? While there's no absolute right answer to this question, most people can benefit from a facelift starting in the early to mid-50s. Some are ready for the procedure as early as mid to late 40s. What is the difference between a full facelift and a lower facelift? So a full facelift refers to a procedure that includes a brow lift, mid-facelift, lower face, and neck lift. In addition, many patients benefit from eyelid surgery such as upper blepharoplasty, removal of excess upper eyelid skin and fat, lower blepharoplasty, removal of excess lower lid fat and sometimes skin, and facial fat transfer. Lower facelift refers to elevation and tightening of the jowls and neck area. Lower facelift can also help with mid-face position and volume as well. Can a facelift procedure be repeated? Yes. If you had previous facelift and now you notice recurrence of neck laxity and jowls, your facelift procedure can be repeated. Can a neck lift be done as a separate procedure? In general, patients with excess skin in the neck achieve best results when lower facelift is combined with the neck lift. Younger patients who have minimal excess neck skin and mostly excess fullness in the neck can achieve good results with neck lift alone. What is the cost for a facelift? So facelift costs can range anywhere from $18,000 to over $30,000 depending on the combination of procedures required to achieve the best result. The cost includes surgeon, anesthesia, and facility fees. The cost covers all the preoperative and postoperative care, including postoperative visits and any phone calls or any other visits in between. Will I have surgical drains after surgery? I usually do not use surgical drains after surgery. Instead, I use fibrin glue, a natural adhesive, to ensure the risk of fluid accumulation and bleeding is minimized. Some patients may require a hemostatic gnat suture, which is a temporary stitch placed through the skin in the outer cheek and neck areas to prevent fluid or blood accumulation. These sutures, or the suture, is usually removed 2 to 3 days after surgery to prevent any scarring or suture tract formation. What is the recovery like after a facelift? Facelift recovery can differ depending on the combination of procedures performed, your healing capacity, and your tendency to swell and bruise. In addition, compliance with pre- and post-operative instructions is critical to successful recovery. On average, it takes about 3 to 4 weeks for majority of bruising and swelling to subside. However, this time frame can significantly vary depending on the patient. Improvements and changes can be appreciated up to 1 year post-operatively. For example, it is normal for skin numbness on the face and neck to take up to 1 year to fully resolve. Also, the incision sites, while nicely camouflaged, can look red for several months after surgery. Facelift sutures are dissolvable except for upper eyelid sutures if upper eyelid surgery is done at the same time, but most are trimmed or removed 1 week post-surgery. Where are the incisions located? In the lower facelift, the incisions are placed in the hidden creases in front of the ear and behind the ear. At the front, the incision also extends slightly upwards into the temporal hair tuft but stays behind the hairline. Behind the ear, the incision runs in the crease where the ear meets the mastoid region and then transitions into the neck hairline with care to stay behind the hairline. Many patients also need a small and camouflaged incision underneath the chin for neck tightening. If patients are also undergoing eyelid and brow lift surgery, the incisions are placed in the upper eyelid crease for upper eyelid skin removal or upper blepharoplasty, inside the lower eyelid or lower blepharoplasty, and a total of 4 small incisions, roughly 1 inch in length, at the frontal hairline and temple for brow lift surgery. If lip lift is being done, the additional incision is placed at the transition crease between the base of the nose and the lip skin. What products and medications do I need to stop before my facelift procedure? We require you stop all nicotine products at least 3 months prior to surgery. GLP-1 agonists such as Ozempic and Wegovy need to be stopped at least 2 weeks before surgery as they delay gastric emptying. Their intake within 2 weeks of surgery can result in anesthesia complications such as aspiration of gastric contents. We also require you stop all blood thinners such as warfarin, Eliquis, aspirin, ibuprofen, herbal supplements that increase bleeding prior to surgery. You will be provided with a list of blood thinners and recommendations for discontinuation timeframe for your specific blood thinners. If you must take the medications for a specific medical reason, we want you to obtain appropriate clearance from your doctor prior to stopping the medication. What physical restrictions do I have after facelift surgery? So we would like you to abstain from physical exercise such as jogging, biking, high-intensity training, racket sports, resistance training, etc. for at least 3 weeks after your facelift surgery. We do not recommend lifting anything over 15 pounds for the first 3 weeks after your procedure. Walking is encouraged as soon as the first postoperative day. What medications do I take after facelift surgery? You will be prescribed medications for pain, which includes Celebrex, which is an anti-inflammatory medication, gabapentin for any nerve pain, and oxycodone, which is a narcotic. You can also take regular Tylenol. Most people do not require oxycodone for pain and feel comfortable with the other medications. Additional medications include a Medrol dose pack, which is a short steroid taper for swelling, Zofran or ondansetron for nausea and vomiting, and ophthalmic antibiotic ointment for upper eyelid incision if you're having simultaneous eyelid surgery. What other instructions do I need to follow after facelift surgery? We will provide you with a very detailed written instruction. Some of the important highlights include sleeping flat on your back for the first couple of weeks after surgery, avoiding extensive neck rotation and extension for the first 4 weeks after your procedure. We also would like you to avoid immerging your head underwater, swimming, and using hot tubs, pools, and baths for the first 4 weeks after your surgery. You can shower and wash your hair the next day, but avoid rubbing your incisions. If you're having simultaneous eyelid and/or brow lift surgery, your vision may be blurry for the first couple of weeks, so appropriate arrangements for a driver must be made ahead of time. Do I need a caregiver after my facelift surgery? Yes, we do require a responsible adult to stay with you after your facelift surgery, including an overnight stay. You will also need someone to drive you to your first postoperative appointment, which happens at our office the day after your surgery. After your first postoperative visit, we recommend but do not require a caregiver. When can I be out in public after a facelift? While bruising and swelling can last 3 to 4 weeks, most people look presentable enough to appear in public without drawing excessive attention after about 2 weeks following surgery. What are the complications after a facelift? While facelift surgery is very safe when performed by an experienced surgeon, complications can occur just like in any other procedure. Luckily, the majority of complications are temporary and resolve either on their own or with minor interventions. I will discuss the risks and benefits of surgery with you in extensive detail during your consultation. When can I be out in public after a facelift? While bruising and swelling can last 3 to 4 weeks, most people look presentable enough to appear in public without drawing excessive attention after about 2 weeks following surgery. When should I expect to see final results? Most patients demonstrate final results between 3 to 6 months after surgery. However, improvements may still be noticed beyond this time frame. How long should my facelift result last? Facelift result should last on average from 10 to 12 years. Determinants of result longevity includes 1, age, with younger patients demonstrating slightly longer lasting results, skin and deeper tissue quality, genetics, smoking, unhealthy diet, and excessive sun exposure, which can all affect the durability of results. Can a facelift procedure be repeated? Yes. If you had previous facelift and now you notice recurrence of neck laxity and jowls, your facelift procedure can be repeated. Will my facelift result look natural? Yes. I perform the most natural facelift surgery to ensure that your results make you look refreshed and rested without any stigma of having had surgery. What technique do I use to perform facelift procedure? So I use state-of-the-art extended deep plane preservation style facelift technique, which releases the necessary ligaments to allow for appropriate repositioning of the descended facial and neck tissues. In addition, this approach allows for less skin undermining and dissection, which decreases the risk of fluid accumulation, called seroma, or bleeding, called hematoma, wound healing problems, and use of drains. In turn, this results in most natural and durable neck and facial rejuvenation results, changing the facial shape from a pear-shaped to more of an apple-shaped configuration, and provides a sharp neckline. How long have I been performing facelift procedure? I have been performing facelift surgery for the past 15 years. I have perfected this technique through intensive practical and didactic courses, teaching and learning from other experienced facelift surgeons, as well as extensive reading on the subject and hundreds of facelift operations that I've performed over the years. What are my credentials and surgical training background? So I'm a board-certified oculofacial plastic surgeon with special interest in facelift and eyelid surgery. I've completed medical school at the Johns Hopkins School of Medicine. After that, I've completed ophthalmology residency at the Johns Hopkins Hospital, where I focused on eye, eyelid, and other facial procedures. I then pursued a 2-year ASOPR certified oculofacial plastic surgery fellowship, where I had extensive training in facelift and eyelid procedures. I've subsequently taught and published on facial plastic surgery, lecturing nationally and internationally on the subject. I also performed hundreds of successful facelifts with long-lasting and natural results.